Hello, my name is Cindy Brown, and I am the guest host today on The Matt Show. I am a blogger and freelance writer. You can check out my blog at www.everydayunderwear.com. It's a humor and general life observation blog. I am going to be asking some questions today of Dr. Todd Austin. Dr. Todd Austin is from Central Illinois. He is a chiropractor, he is a mat therapist, and he is also a cold laser therapist and consultant. He teaches people how to use the cold lasers all over the United States. Today I'm going to be welcoming Todd and asking him to give us a little bit of comparison between cold laser therapy and mat therapy. First, if you would tell us what each of these therapies are and the benefits of each.
Okay, thank you, Cindy. And as a person who is a cold laser consultant and someone who sells mats and teaches people how to use them as well, that's a question that I usually get at least every few days. I get someone on Facebook private messages me and says, well, which should be better? I've got so much money, I don't think I'm adding a new therapy to my practice. Would cold laser be better or would mats be better? So that kind of leads us into this. So cold laser therapy is something that I've been learning about and studying for 11 years. I've been practicing it, I say daily, but I work 4 days a week. So 4 days a week in my Verdon, Illinois practice at Austin Family Chiropractic. I have performed over 21,000 cold laser therapy treatments in 10 years. So it's something I do every day, and it's something I do pretty much all the time. There are days I do way more cold laser therapy treatments than I do chiropractic adjustments, put it that way. Then the mat is something that I only found out about less than 2 years ago. We've been selling them for 15 months. We've been using them for a little longer than that, about 20 months. But it's something I've done a lot more cold laser than I have mat. At this point I do a lot of both. And so cold laser, the thing that fascinated me about cold laser, the thing that got me into cold lasers is that I used to suck at shoulder problems, I used to suck at knee problems, and it really just kind of got under my skin that I was no good with those things.
With regular chiropractic
With just
treatment,
chiropractic.
you
If
mean?
chiropractic is my only tool and there's nothing out of alignment in that shoulder or that knee, there wasn't a darn thing I could offer that person. So with cold lasers, we can target muscle cells, we can target bone cells, we can target nerve cells, we can target ligaments, tendons, any of the above, all of the above. And so if it's not a bone out of alignment, no big deal. We can work with that anyway. That's the thing that fascinated me about the cold lasers. The thing that fascinates me about the mat is it's just another thing in my toolbox, what I call the 21st century medicine cabinet. And I talk to my patients about that and say, when I was a kid, in the medicine cabinet, we had like drugs. Get a headache, here's a drug. If that didn't work, we'll take you to MD and get heavier duty drugs. And then we'll put them in the medicine cabinet. But the 21st century medicine cabinet, we have things like essential oils, extra virgin coconut oil. We have apple cider vinegar, we have cold lasers, we have mats. And we just have a lot of things where you don't have to run to the doctor for everything. And the mat is one of those things that when people get one, they use it on a daily basis. They sit on it every day. They sleep on it every night. So it's helping to heal them. As long as they're on it, it's helping to heal some. Mm-hmm. Now with the cold lasers, we're limited by a certain dose. We can only really do about 20 minutes a day with the stronger lasers. With the at-home lasers that are not as powerful, I usually have patients do 30 minutes a day with those. But the way they both work similarly. So I'll first describe what they both have in common.
Okay.
So cold lasers and mats, they decrease pain, swelling, edema, and inflammation. They increase range of motion. They give the cells more energy by stimulating the mitochondria. The mitochondria is the energy factory inside the cell. And so the mitochondria have receptors that are basically turned on by visible red or near infrared in the case of cold lasers, or far infrared in the case of photons. so those cells produce more energy. And then the other thing that they both do that I love, I work with a lot of athletes.
Yes, you are the official chiropractor for the Springfield Foxes football team.
Yes.
So you use both of these therapies to treat
Exactly.
football
I'm
players.
4.5 seasons in with the Foxes, so middle of my 5th season, and so we use a lot of both of these. I use the cold lasers on the sidelines because I don't have to plug them in. But then when I get these guys into the office, I use stronger lasers, and then I also use the mat because obviously I have a place to plug them in there.
Mm-hmm.
And then some of them have mats that they can use at home to rehab their injuries as well. But the thing that I love working with athletes and just working with my patients that both the lasers and the mats bring to the table is we can basically increase the damaged tissue's ability to handle additional stress. And any one of us, whether we're an athlete or not, we're going to a job today that's putting every day that's putting stress on our body. We're working in the yard, we're doing housework, we're lifting kids, if you have little ones, just different things we're doing. Or we're an athlete, we're going out playing football again, even though we have a weak hamstring, something like that. Or we're going out and playing basketball again, even though we've had a shoulder problem. So it's just something that we can increase those once damaged tissues' ability to handle that additional stress. And a lot of times we can totally heal up an injury and it's never a problem again, even though we keep playing.